Okay, let's go over, excuse me, the pathology associated with hematopoietic disorders. So alterations to the creation of the various blood elements. So we'll start out with one of my favorite. It's very dramatic. That's why I like it. Anemia literally means without blood flow. So anemia in the simplest sense means that the hematocrit levels are below normal range, which, as we saw from the blood draw, when you spin down those cells and they separate by weight, the hard-packed red blood cells at the bottom of the tube are the hematocrit. And there should be 45% of, not white, that's not going to work. We won't be able to see anything. So there should be naturally a 45% just level of red blood cells. It is going to change in people. You will have to look up by age and disease type what the normal hematocrit range should be, but technically, in a broad sense, anemia is categorized when you have a low level of hematocrit, so low level of red blood cells or hemoglobin. And in a umbrella sense, anemia is associated with symptoms of hypoxia, which means low oxygen. So people feel weak, tired, they become pale, they lose some of the color in their face, they're lethargic, and it's difficult then to make the heart rate changes with exercise when every time the heart beats, it has to deliver more blood, so there has to be a higher stroke volume, or it has to increase the heart rate. So that's going to make exercise more difficult, so you're going to feel tired and people will appear pale and exhausted. The causes of anemia are varied, and you don't know which type of anemia somebody has until you actually look at the blood cells. So if you think about the normal shape, the biconcave red blood cells, just having the complete blood count showing a low hematocrit level is one part of the story. You don't know what caused the anemia until you look at the shape and the color of those red blood cells. And depending upon the presentation of the blood cells, it lets you know if it was caused by a bone marrow insufficiency, so there's not good signaling to the stem cells, if there weren't enough raw materials to create the hemoglobin or the red blood cells, if there was damage to the marrow, so that's called aplastic, which means without substance, without making anything, anemia. In that case, that could be because of chemotherapeutic drugs or radiation that has destroyed the bone marrow. When the marrow is damaged or destroyed, then a bone marrow transplant is really one of the only ways we can target that. It can also be caused by just losing the red blood cells. So there could be bleeding in the body. The red blood cells can look abnormal. And if they look abnormal, the spleen desires them very heavily. So it will clear them at a faster rate. When the spleen is breaking up those things, that is a form of hemolytic anemia. Lytic comes from lysis, which means to break apart. So that could be due to abnormal blood cell shape. That could be due to a hyperactive spleen. And the final thing would be autoimmune cases of red blood cell destruction, which you could search for an antibody to the red blood cells that exist in some people. So here are your morphologic classifications. So what do the blood cells look like? So these are important things to keep in mind because these let you know what type of anemia that person has. So if the cells are normal in size and appearance, so they're normal size, normal color, we call them normocytic, normal cells. So here's a normocytic red blood cell. There's macrocytic cells. Macrocytic means they're really big. So in this case, we've got a macrocytic megaloblastic cell. So it's really, really big, hyperpigmented. When you see really big cells, that's going to tip you off that there's something insufficient, and it's typically folic acid or B12, or it could be both. In the case where it is both, you will actually see some abnormal white blood cells associated with that too. So those could be megaloblastic as well. There's microcytic cells, which describes really small cells. And then there's normochromic, that would be normal color. So there's that. Normocytic is normal size, normochromic is normal color. Hypochromic is low pigmentation, and the pigment in red blood cells is hemoglobin. So this is showing you a blood smear of, whoops, we lost it, hypochromic microcytic anemia. So I want you to notice how we've got some pretty good looking blood cells here, but the majority of them are very hypopigmented. We only see a pink ring on the outside and very low pigmentation on the inside. I'm pointing this out because this is the most common type of anemia in adults, hypochromic microcytic anemia. And that is caused by reduced hemoglobin when it's hypochromic, and that usually means that there's not enough iron. So that's called iron deficiency anemia, which presents as hypochromic microcytic anemia. So in a blood smear, those cells look just like I showed you on the slide prior. They're small and they're not really red. It's most common, and there's a couple of different causes, really dependent on age. So it could be due, especially during growth spurts. So if you think about infants, if you think about teenagers going through growth spurts, those are times when there's going to be a higher level than normal need for iron. Because as the body's growing, it's going to need more blood, and there's going to need to be more red blood cells as well. So you'll see this in infants during periods of rapid growth. Just a little note that formula is iron fortified, so if the infant is on formula and appearing with iron deficiency anemia, it can either be a case of malabsorption, so damage to the intestines, or a case of somebody thinning out the formula and not using the full amount that the infant is supposed to have. Again, adolescents going through those really long bone growth spurts, if they're not having a high iron intake in coincidence with the growth spurt, that can lead to this as well. It can also be due to red blood cells actually leaving the body through chronic blood loss, and that's one of the most common cases you'll see in adults. Laboratory tests that you want to order with anemia to detect iron deficiency anemia, you would see levels altered in ferritin, iron, and the ability of iron binding to occur to transferritin. So we want to see how likely it is that extra iron will stick to the trafficking protein, because that lets you know if it's more sticky, it's more attracted to it, and that would happen in low iron states. So you want to order those tests. You want to know how much is in the stores, how much is in the blood, and how likely the blood is to take up iron when it's given. So a characteristic lab profile would be low serum ferritin. And remember, ferritin is stored iron, which means the body has already run through its stores. There's low serum iron because there's no iron left. You would see high normals of serum iron binding protein because it's out there looking for iron to bind, and normal percent iron saturation. And when something is saturated, it means that it's covered in something. So there's not a saturation we would see typically in a red blood cell. So the treatment is going to depend on the cause. It's really easy to supplement iron if that's the issue, that it's inadequate in the diet. Again, in infants, that could be adding more iron fortified formula. For adults, you can add iron supplements. They're super cheap. They're usually read just to make sure people have recognition of their medications. One thing to keep in mind is that iron supplements are very constipation causing. So if the case is GI bleeding related, we don't want to necessarily go with a pill for iron because that's going to cause constipation and then make it more difficult to pass stool and possibly exacerbate GI bleeding. If you don't want to give somebody a supplement, or somebody doesn't want to take a supplement, there are some food supplements like blackstrap molasses. You can find this at most stores. It doesn't taste wonderful, but it's very, very high in iron, and it can be taken just by the spoonful, or it can be mixed into something like oatmeal or cookies, which are delicious, right? So some histories, you'll see, again, infant with poor diet, thinned out formula. There should be about 2 scoops of formula for each bottle. And if you're not familiar with formula costs, it's very expensive for each canister of formula. So sometimes people will give less than the 2 scoops, maybe 1 scoop, maybe half of a scoop, and that's going to lead to low levels of iron. So that also lets you know if the infant is not formula fed, if they're breastfeeding. and they're iron deficient. They do sell iron drops that can be just put on the tongue. They taste like sugar. They're really delicious, and infants love it. In adults, you can see that the most common cause of iron deficiency anemia is that you're actually losing blood because your body is going to try to recycle all the iron it can to, maintain energy and not have to reinvent the wheel. So GIT is gastrointestinal bleeding, which we know is a really common symptom associated with colon cancers, because that's one of the most prevalent cancers. When that occurs, it might not be frank, bright red blood, so there might have to be a fecal occult blood test done. But when you do see iron deficiency anemia in an adult, just keep in mind that we do recycle our iron. That usually means that they're losing blood somewhere. In women, this can also be due to menorrhagia, which is very heavy levels of menstruation. So usually in a menstrual cycle, which lasts 5 to 7 days, women should not be losing more than 3 to 5 tablespoons of blood. In menorrhagia, there is a higher level of blood loss, and that blood loss can be so significant that you see iron deficiency anemia. And you can also see that somebody is donating blood too frequently. They do monitor this somewhat, and this is prevented. I don't mean to laugh. They used to pay people to get blood donations, so you would get a couple bucks every time you donated blood. So you can imagine that if you really needed money, you can schedule a couple extra blood donations to get some extra cash, but you can't do that too often because you'll end up with iron deficiency anemia. So they no longer give you monetary rewards for donating blood. It's supposed to be done out of the goodness of your heart to prevent iron deficiency anemia. And because, again, in adults, GI bleeding is such a common complication associated with colon cancers and colon disorders, you will see that iron deficiency anemia is the most common presentation of anemias. So here's our normochromic, normocytic cells, and here is hypochromic microcytic. And you should know what that looks like because it is the most common. That's what it is. Okay, then if you have really big cells, that lets you know that there is an abnormality of a raw material. Primarily, this could be B12 or folic acid. B12 is contained in anything with a phospholipid membrane, so that means anything that's animal-derived. Human milk, human flesh, animal flesh, milk, yogurt, cheese. All of those things contain phospholipids, which are modified into B12. So when there is low B12 or low folic acid, you will see that there's really big megaloblastic red blood cells. They're very large. This is them next to a white blood cell. And just for comparison's sake, here's a normal red blood cell next to a white blood cell. They're quite a bit bigger, so it should be like triple the size of the red blood cell. Here you see that these red blood cells are pretty close inside to these abnormal neutrophils. Okay, so these are red blood cells that are much larger than normal. Megaloblasts, remember blast means an immature cell, so a megaloblast becomes eventually a large mature red blood cell, which would be macrocytic. When there is a deficiency of B12 and folic acid, not only do you have really big red blood cells, there's also these abnormal hypersegmented neutrophils, which usually have about 5 nuclei. So you can see that there's a huge amount of nuclei here. Those are abnormal, and that lets you know that the patient is deficient in folic acid and in B12. If it's just one of them, you're only going to see the big red blood cells. B12 is also required to make the other products of the marrow, so platelets and white blood cells. So even though the anemia is usually the predominant symptom and that somebody's really tired and it's hard for them to work out and they feel terrible, you will also see that there might be clotting abnormalities and white blood cell deficiencies, which could lead to a difficulty fighting infection. Folic acid deficiency anemia is also pretty common. We don't store a ton of folic acid, so any store that's in the body is really rapidly depleted. You'll see this in a couple of different cases. Again, this is going to be associated with macrocytic cells, so they're going to be really, really big. If that patient is deficient in B12 and folic acid, not only do you see big red blood cells, but the hypersegmented leukocytes. So this could be due to somebody having inadequate diet. In chronic alcoholism, there isn't a strong message to eat or seek calories because alcohol is so highly caloric. So you can see this associated with alcoholism. This could be due to intestinal absorptive problems in chronic bowel diseases or microflora damage. And also in pregnancy, the difference between like a prenatal multivitamin and a normal multivitamin is that prenatal has high levels of folic acid. The infant or the fetus or the embryo, depending on which stage it is, will take the folic acid that they need. What that means is the fetus will take everything that they need, and then the mother will be the one lacking in folic acid and will be feeling tired. So folic acid is in a lot of different foods. I mean, pretty much everything has folic acid in it. If it comes from the ground, chances are it has some folic acid. You also find it in cereals and other fortified things. Okay, a type of B12 anemia, we've talked about in patho before, pernicious anemia. Pernicious anemia is low B12, but remember it's caused by physical damage to the gastric lining. So the stomach is actually damaged. And intrinsic factor is a product of parietal cells, and parietal cells, they make intrinsic factor. And when they're damaged, intrinsic factor can't bind B12, so therefore B12 can't enter the circulation in absorption. The causes of this most commonly are mucosal atrophy. The most common cause of that is gastritis. The most common cause of gastritis is chronic alcoholism. This can also occur when somebody has gastric resection, so in gastric bypass surgery. If there's a part of the stomach that is removed or not utilized, that limits the amount of intrinsic factor. Or if there is a distal bowel resection or bowel disease, that can cause mucosal atrophy as well. There's also autoimmune disorders which cause antibodies to develop that attach to and then lead to destruction of the gastric mucosa. And when you have low B12 and it starts to get really low, you'll see central nervous system effects. So people feel nerve tingling, kind of like your foot is falling asleep, but it's all over the place. And this is found often by dentists because the tongue becomes so enlarged and bright red. It feels like initially the patient burnt their tongue is what they report, and then it becomes more sore over time. This is what this looks like. You can see these cracks starting to form in the tongue. So this is something that can be reversed by just giving B12. Remember, you can't give a pill for B12 absorptive problems because there's nothing there to bind it. So in this case, you have to give injections of B12. Once this occurs, those B12 injections, they're given for life. Okay, some other things that can lead to anemia are just suppression of bone marrow activity. That can happen due to chronic disease, just because of overworking of the marrow. Aplastic anemia is damage to the marrow and no creation of red blood cells, something growing in the marrow like a tumor or fibrotic tissue. So something is suppressing marrow activity. So therefore, you need to find the cause of that and then hopefully treat it. If it's due to things like autoimmune damage of the marrow, you can suppress the immune system using immunosuppressive drugs. In the meantime, you can give blood or platelet or both transfusions to supplement blood that's not being made. This should be an O, but yeah, bone marrow transplant, if there's physical injury and destruction of the marrow, getting a donation of bone marrow from someone is one of the best ways to restore activity. Cyclophosphamide is a drug that's most commonly thought of as a chemotherapeutic drug, and what it does is suppress the immune system. So this is somebody who had a damage to the marrow because of an autoimmune disorder, and what you're looking at is a picture of the marrow, and the bluish spots are red blood cells that are being created. And you see almost none of them there, right? So once this was discovered and the antibodies were found, they were put on this drug cyclophosphamide to inhibit the immune effects of these antibodies being created and tagging the marrow. And what you see after a couple of months of treatment is now we start to see these bluish spots pop up again. So using these medications suppresses the immune system, if this is the cause, and allows red blood cells to be created again. So once you determine the cause, then you can pick an appropriate treatment. Okay, and then we have hemolytic anemia. There's different types of hemolytic anemia. There's acquired and there's genetic. So these types are going to be genetic abnormalities, and these are going to be predominated by abnormal shapes of blood cells. And remember, for the spleen, if there is an abnormal shape, if they're bigger, they're going to be cleared more quickly. So first off, there's spherocytosis, which is just an abnormal shape. That's something that individuals can carry different markers for. And spherocytosis is going to be present in a bunch of different disorders. So the first is sickle cell anemia with an abnormal hemoglobin molecule. This is associated with patients of African descent, especially along the malarial belt. And something about sickled red blood cells is that they can't bind malaria. So it might be something evolutionarily helpful. However, it can cause something called a sickling crisis, which can cause a huge amount of ischemia and tissue death. Thalassemia is defective hemoglobin synthesis abnormal shapes of red blood cells. So you'll see some macrocytic, some hypochromic, just all over abnormally shaped red blood cells. This is more common in genetic lines associated with areas in Greece and Italy. And then finally, there is an inborn error, glucose 6-phosphatase dehydrogenase deficiency, which leads to very large abnormal hyperchromic red blood cells. And again, they're really, really big, and they're almost immediately broken down by the spleen. So instead, we would see normal-shaped red blood cells living for about 4 months. When they're abnormally shaped, the spleen is going to clear them at a much faster rate, meaning that the marrow has to be overactive, and there's going to be symptoms of hypoxia. This is showing you a closer-up view of what we call a sickling crisis. So when blood oxygen tension is low, the problem with these sickled shaped red blood cells is that they can clump, and when they clump in a sickling crisis, they obstruct the microcirculation. So that means anywhere this vessel is leading to will have an infarct in some cases. So this is, again, abnormal hemoglobin. The crescent shape is not flexible. It only lives 20 days instead of 120. And again, in low tension levels of oxygen, these sickled cells clump together and block the microcirculation. That's called a sickling crisis. You can see this in the lungs. The symptoms of this actually resemble those of pneumonia. So if somebody ends up in the emergency room, if they have sickled cells, you might want to test them and see if that is the case of their lung issues. Okay, and then there's acquired hemolytic anemia. That means something else is breaking down the red blood cells. It's not because of a genetic error. There's just a hostile environment and they're not surviving the way that we would want them to. So that could be because of an antibody. So in this case, this is called cold autoimmune hemolytic anemia. When people go outside or anywhere that's cold, there is an activation of auto or self antibodies that are attracted to red blood cells. One of the antibodies, especially the first one that's made, it looks like a throwing star. It has 5 sides on it. It's called IgM, so it's a pentamer. When that's activated, it becomes activated in areas that get cold more quickly. So places like the fingertips, the nose, the toes. It activates IgM and all these red blood cells stick to it. Those are called agglutinates, and imagine how delicious this is going to look to the spleen if it makes it there. So this is something that would be treated with immunosuppressive medication. So this is an autoimmune disorder. It could be mechanical trauma, something's physically breaking down the red blood cells, you have to find out what it is. Enlargement of the spleen, that's splenomegaly. The bigger a spleen, the faster it clears red blood cells. So that's an acquired case. And if somebody has an artificial heart valve, those are made of like metal, steel material, and as red blood cells flow through them, they do damage the red blood cells, so that can cause acquired hemolytic anemia. And then finally, the opposite of anemia is polycythemia. That means excessive cells in the blood. So this can either be primary or secondary. Primary is called vera, which is Latin for truth. It's true polycythemia. For whatever reason, the marrow cells make lots of copies of themselves, so there's marrow hyperplasia, and then there's a huge amount of creation of blood. So in primary or vera polycythemia, it's overactive marrow, so you have to give drugs to suppress the marrow function. Secondary polycythemia is something else which encourages EPO release. So that could be a respiratory disorder, a cardiac disorder, intentionally taking EPO. And in the case that it's secondary polycythemia, I mean, in all cases, there's going to be red appendages, they're swollen. And in this case, if there's too much blood, then the spleen is going to have to get bigger. So that's going to cause the abdomen to be sore. And then they have to be careful to engage in contact activities because the spleen can rupture. The way to treat secondary polycythemia is not going to be medications that suppress the marrow because it's a different cause. In that case, they will have repeated phlebotomies. So that is the removal of blood. So magic, fun. So to see what type of anemia there is, you first want to do the CBC to see the level of hematocrit. But a really important step is actually looking at the blood cells to see what they look like. And once you know that, then you can determine the cause and then plan a treatment. If you think that it's marrow related, there can be a reticulocyte count that's ordered for. You can detect some reticulocytes in the circulation, but you can definitely do a marrow aspiration to check for reticulocytes. You can order lab tests to look for levels of iron, B12, folic acid. Bone marrow studies, again, that would be an aspiration of the bone marrow to see if the precursor cells are there and if they look normal. And because hypochromic microcytic is so normal in adults, you want to possibly give a GI evaluation, a fecal occult blood test, possibly a colonoscopy to locate the site of the bleeding. Okay, finally, the last thing we'll talk about is abnormalities in white blood cell production, or just general white blood cell abnormalities. The white blood cells are part of our immune system, which is associated with the lymphatic system. The lymphatic system, wherever you find blood vessels, you find lymphatic vessels. They're very leaky, and things move against gravity in them, and they have some organs associated with them, like the spleen and the bone marrow that we've talked about, the thymus, and also the lymph nodes, which are really just concentrated areas where there are a high amount of immune cells. So as things flow through these lymphatic channels, they would be filtered by these lymph nodes, hopefully killing any of the pathogenic material within them. However, lymph nodes themselves can become infected, which we're going to see in just a second. So different white blood cell abnormalities. The first one's just a deficiency of white blood cells, leukopenia, low white blood cell count. This would be diagnosed by a CBC to look for the level of white blood cells. And if there's low white blood cells, there's going to be difficulty fighting infections. You might see people presenting with symptoms of illness. This could be an inadequate production by the marrow caused by radiation or drugs, like chemotherapeutic drugs, a tumor growing in the marrow, and same thing with anemia. You need folic acid and B12 to make white blood cells. So you want to look at the size and shape of them and determine what the cause is. If there is an infection of the lymph node itself, it's called lymphadenitis, so inflammation of the lymph nodes. These are also called buba, so you might have heard of the bubonic plague. Buba is another term for an infected lymph node. And infected lymph nodes, that means that instead of clearing out the pathogen, it's got lodged there, and now there's just an infected lymph node. Lymph nodes, they drain tissue, so like the submandibular lymph nodes, they drain like the nose, the mouth, the ear. So you would expect in some cases, if there's a really severe infection, that sometimes that infection can lodge in the lymph node and then infect that. So bubbas, or really large lymph nodes, they're red, they're swollen, they feel rubbery. This guy has purulent exudate in there, which tells you it's an active pussy infection. And in some cases, these have to be drained. The bubonic plague, the bubbas were located in the inguinal lymph nodes, which are the ones towards the pubic area. So that was a fun disorder. Finally, we've got the Epstein-Barr virus, which causes mononucleosis. For those of you who've had mono before, infectious mononucleosis is an infection of B cells. B cells are the ones that differentiate to memory B cells and then activate plasma cells to make antibody. So they become infected and then they start to kill off. So killer T cells and antibody cells, they help kill the infected B cells, but now you don't have those B cells. You're missing a big part of the immune system. So people get really, really sick with this. Really large, tender lymph nodes. They're very tired. When you have such high levels of abnormally shaped white blood cells, in the same way you have red blood cells cleared really quickly, these white blood cells will be cleared, which means the spleen's going to have to get bigger. So that can cause quite a bit of pain as the spleen enlarges. You have to be really careful with engaging in contact activities because, again, the spleen can rupture. And here you see all the signs and symptoms of mono. People are very, very sick with it. You can take a look at some pictures of the white patches that are characteristic on the tonsils. In mono, there's also a lot of cervical lymph node swelling. It's also called the kissing disease. You see these people kissing and then also rubbing their ice cream cones together, just being super gross and sharing all their mouth bacteria. So you get very, very sick, and you have to be careful not only to avoid sports and a spleen rupture, but if somebody's already immunocompromised and they're losing all of their B cells, that can actually lead to a type of inherited lymphoma in some people. So you want to be gentle with them, you want to keep them hydrated, and allow healing to occur. It takes months usually to get over this. This is what an abnormal lymphocyte looks like in mononucleosis. This is an abnormally shaped white blood cell, and it's also like an amoeba that is attached onto red blood cells. So that means as this white blood cell gets cleared by the spleen, it's going to take these red blood cells with it. So that's going to drive symptoms of anemia, leading to feeling more tired and exhausted. And that's it. Thanks for listening. I hope you can answer this question. There's a best answer, I promise you.